Aye.
Aye.
The minutes are approved unanimously. Thank you. So first on our agenda, may we say that this wasn't the first effort for a wellness revolution in Kentucky with this MAHA task force. Our esteemed chairperson, Senator Higdon, has served in the past on a very meaningful task force. And then, of course, a life as a grocer as well. And was asking for the last 3 meetings to address our committee. And we found a spot, one of the most important, impactful spots as we wrap up this MAHA. Senator Higdon, would you please introduce yourself for the record?
Thank you, Madam Chair and members of the committee. I'm Jimmy Higdon, Senate District 14. And thank you for allowing me to be here today. You had me on the schedule once before, but conflict kept me back. We did have, you have in your folder, a report from the 2011 Childhood Obesity Task Force that we did back in 2011. Story, I want to tell you a story. I got a call one day from Senator Stein's office, who our President Pro Tem, that invited me to serve on this Childhood Obesity Task Force. And I asked this young lady, I said, will you ask Senator Stein, why does she want me on this task force? Is it because I'm fat? Or is it because I'm a senator? She said, I'm not going to do that. And I said, well, I'm not serving if you don't ask her. So she called me back in about 15 minutes, and really, she said, Senator Higdon, I found out what you wanted to know. She's asking you to serve on this task force because you own a grocery store. And I said, very good answer. Because at the time, I was a big old boy, a healthy 330 pounds, severely obese. And during that task force, I'd prayed for years to lose weight. Every bone in my body hurt. Tom Reiner, who served on that task force one day, brought me a book. And I saw the title of it, and I said, here, give it to me. I know who sent it. But it was a Healthy Heart Diet. And I lost 80 pounds in about a 6-month period. And with that diet. And still could never get, that got me to 250. I needed to get to 229 to not be obese. And I figured, with my position, I like to set a good example, and I didn't want to be technically obese. So during session last year, I did lose 25 more pounds listening to the Dr. Gundry podcast and following his plan. So I'm officially, as I talked to you this morning, I'm officially not obese anymore. So that was one of my success stories. But as you see, we did have a task force, and it was a childhood obesity task force, and just kind of at the time in that report, it says that it compared Kentucky and Mississippi. We were both very bad in the as nationwide as far as childhood obesity. 21% of Kentucky's children were obese, and 18% of Mississippi's. I did a search last night, and it's 24.6 Kentucky kids are now obese. So we're going the wrong direction, and 24.3% of kids in Mississippi. So in 2024, back in that 2011 task force, it said that 25% of Kentucky children, 17 to 24, were ineligible to join the military because of weight. Today that number is 1 in 3. 30 to 35% can't serve. So the problem was not getting easier, getting better. It's getting worse. But in our task force back then, we did some things. We recommended additional physical education because, as you all know, CARA did away with, kind of crowded, I guess, changed things, and physical education was one of them that kind of went away. We talked about nutrition, fruits and vegetables, in children's diet. We adopted a thing called classroom-based physical activity, and you've heard of that, where you every once in a while they get up and do some knee bends and some sort of exercise. And we talked about complete streets, bike lines, and sidewalks, and safe routes to school. So that was pretty much what we did during that task force. But the key thing I wanted to say about my serving on the task force, we had a group of folks one day that were dietitians and were, I guess, from the health departments or other organizations. There was 3 at the table, and they talked about how bad the childhood obesity problem was in Kentucky. And I asked one of them a question that I knew the answer to. I said, is there one particular group of children that are more susceptible to being overweight than other children? And the lady got all excited. She says, oh, sure, Senator. Low-income kids are more susceptible to being obese than any other group of kids. And so what do all low-income children have in common? SNAP, or as we called them back in the early days, food stamps. And believe it or not, I was in the grocery business when food stamps were in their prime just introduced. And at the time, a typical grocery store would have about 8,000 items in a grocery store. Today's grocery store has probably about 60,000 items. And many of those additional items have sugar in them, so we kind of know where I'm going to with that. But and two, I feel like government has been at the root of 2 major epidemics that we've had in the country over the years. Obesity, SNAP or food stamps is really, I think, the root of that problem, and drug abuse, Medicaid. Back in the early days, we had a lot of pill mill legislation where a lot of doctors were prescribing pain pills, and they were actually qualified at getting those through Medicaid and not paying anything for them, which made a real good business model to get something for free and sell them for quite a few dollars. So that was an issue then. But one of the things that I've constantly asked for, I've lobbied numerous times, and I wanted to. I don't know if this task force would consider it or not, but it's just I wanted you to know what something I've lobbied about and written numerous letters to the Ag Commissioner and the U.S. Department of Agriculture and the Health and Family Services here in Kentucky to ask for a waiver where we could do SNAP benefits, do those twice a month instead of once a month. Being a grocer, I see people, or did, I haven't been in the grocery business for a while. Super Walmart convinced me I need to be another line of work. And but anyway, the one of the things that I saw every month when people came in with their SNAP benefits, they would spend them all in one day, the whole thing. And they'd get a grocery cart and they'd have 4 cases of Mountain Dew, 4 bags of potatoes, maybe a bag of apples and a bag of oranges, and maybe 1 gallon of milk, because they were buying for a full month. And a gallon of milk won't last a full month. Fresh fruits and vegetables won't last a full month. And not only that, all of our farmers markets through the federal program, all of our farmers markets now during the summer will give you $2 worth of produce for $1 in SNAP benefits. But a typical family doesn't have any SNAP benefits left toward the end of the month. And we teach our kids in school. We talk to them about putting fresh fruit and vegetables in their diet. But toward the end of the month, they don't have any. So that was one of the things I've lobbied for over the years is SNAP distribution twice a month. And the first thing they tell me, oh, we can't afford that. Too many of them. And when you do the numbers, the biggest percentage of SNAP benefits are under $100. A lot of single people, a lot of senior citizens get SNAP benefits every month, and they're less than $100. So you can eliminate those. so it wouldn't be that expensive. But again, it's they looked at me like I had three eyeballs when I suggested it. But it is something that I do believe would help. And also, we talk about food deserts. I've been in the grocery business, and I can tell you from the beginning, the first 10 days of the month till the end of the month, that last week of the month, my business would probably drop about $30,000. That's how much SNAP benefits meant to a typical grocer in a rural area. It was quite a bit. So it would drop quite a bit. So you look at a retailer where we have food deserts and urban areas in the center, urban core, where you have food deserts. You look at a grocer that's trying to operate a business, all month, and all their business, the majority of their business is the first 10 days. It's difficult to keep the doors open. It's hard to schedule help. It's just a lot of problems with that. So doing the multiple distribution of SNAP benefits would help with having fresh fruits and vegetables in the house for those young people, and would also help with those food deserts. And the grocery stores would love you too when you spread those benefits out all month, and they had a consistent business model instead of all their benefits coming in the first 10 days. You could spread it out through the month. And I had a lot of part-time help in my grocery store, and at last week of the month, they didn't get a whole lot of hours because, it had to be flexible. But one of the things that I know you've talked about probably during this, I hope you have, that all the states around us have applied for waivers for their SNAP benefits, not to include soft drinks and candy. There's 18 states across the country that have applied for that. And so Kentucky is kind of an island. All the contiguous states, Ohio hasn't passed the legislation yet. The rest of them, I think, are due to go online with their waiver January the 1st. Ohio is still working on it, but if they pass it, then every contiguous state to Kentucky will have this in place for 2 years. Kentucky will do very well in cross-border shopping over the next couple of years if that goes into place, and Kentucky doesn't do anything to follow suit. So anyway, it'd be those grocery stores in the border counties will see a big increase in business. But so that was the my thing I wanted to talk to you about today, is that we have had a task force before. We did some things we thought were beneficial. I don't know that over the years that many of them were followed through. Obviously, we were concerned about childhood obesity, and it's worse today than it was in 2011. And that's kind of the message I from time to time I'd get aggravated with Senator Julian Carroll. He'd always give us a history lesson, and I asked him one day if we could get 3 hours credit in history every session, because he would continuously give us history lessons. But I did want to share that with you. None of you all were around when that was done, and just wanted to share that little bit of information, and be glad to answer any questions, Madam Chairman. And thank you all again for listening to me.
Thank you, Senator Higdon. And if we have any questions, I do want to acknowledge that your time coming before us, we are so incredibly grateful, and you're welcome to give us a history lesson, or I'll take one offline from you anytime.
Well,
Thanks for going before us. I really appreciate your thoughts on SNAP, and we kicked off our time in our task force in June with quite a bit of discussion. What's in your time here, probably the last 14 years since the 2011 discussion, have you seen more fraud in SNAP or food stamps? Your point of twice a month, I wonder if that could impact or influence that these funds are getting to the people that really need them, as opposed to maybe being abused a bit?
Well, SNAP, it is a abused program. I've seen a lot of cases. I've contacted every administration since I've been in the General Assembly to ask them if I could help them, understand fraud. There's a lot of people in Kentucky and across the country that sell their benefits. That's why we have kids that don't have anything to eat. Why we have to do, the backpacks and food banks, and they're selling their benefits. And the stores that are buying those that they're doing that in are small. I don't want to pick on any one group, but they're the same group that gives us problems on some other things too, on cigarettes and vapes, and but they sell those for 50 cents on the dollar. It'd be very easy to detect that, because if you look at a person you look and they spend their entire benefits in one trip in a store that probably doesn't have $4,000 or $5,000 worth of inventory that would be eligible for SNAP. So it's easy. It would be easy to detect, but it takes effort. Kentucky has been dinged by the FDA, USDA about our administrative, where our error rate is very high, and I think that's we could cut way down on the number of eligible recipients, and those eligible recipients, I think we could find out that there's fraud. And one of the things that I see that aggravates me is there's workarounds. When I had a grocery store, I could not afford to lose the SNAP benefits because it's a big portion of my business. And we follow the rules, but I see the rules being broken. And, you can't buy prepared food, ready, hot food that's ready to eat. You can't do that. If a store has a deli, I could sell fried chicken cold after put it in the case and sell it cold, but I couldn't, and take SNAP benefits, but I couldn't sell it hot and take SNAP benefits. And there's a lot of stores are now doing pizzas where you actually say you're buying the ingredients and they cook it for you, which is really bending the rules. But there's a lot of fraud. But the reason there's fraud, there's just maybe it's not really fraudulent, but a very liberal interpretation of what the rules are, and nobody looking over their shoulder and smack them on the hand and say, hey, you can't do that.
Well, thank you for that. And we know in appropriations and revenue in several committees, it's been shared with us that if the fraud's not reduced or eliminated, then the federal government isn't going to pay those dollars out to the state, so the state has to come up with it, and that'll be very interesting. You have 3 people on our list that have questions for you.
Okay.
Senator Douglas.
Thank you very much, Madam Co-Chair. Senator Higdon, I just want to first start out by thanking you for the contributions that you've made to the Commonwealth overall in all the years that you've served in the General Assembly. I think I can speak for our colleagues and everyone around. You've made tremendous contributions, and I just wanted to make sure that we get that on the record, and we appreciate the contributions that you've made. Often we hear people talking about food insecurity, and coming from the healthcare space, I often wonder whether we have been using the wrong term for a long time, because often it is not the lack of food, but it is the choice of unhealthy foods and the lack of proper nutrition that's producing some of the issues. So perhaps one of the narratives that we need to take a look at in our General Assembly is this food insecurity, when we really are looking at improper nutrition. I want you to know I really appreciate what you talked about in the 2 programs you talked about, meaning the Supplemental Nutritional program and mentioning Medicaid. A lot of people never really think about the guardrails that are around those programs, and the lack of accountability that we have within those programs for people to get proper nutrition. You know, I talk about with both of those programs, if people are not going to access proper nutrition on their own, perhaps we do need to put some further guardrails or some more stringent guardrails around those programs that will offer them, as our two co-chairs are trying to do, that will offer them the appropriate path, the appropriate good nutrition path. And if they choose not to be in the program, that's entirely up to them. But for those people that we are responsible, that we're showing a response to, who wish to be in the program, then we do need to have those guardrails to say, if you're going to be in the program, we at least are going to make sure that you're going down the path of proper nutrition. Again, if you don't want to be in the program, it's an optional program. You don't have to be in it. So I guess I didn't really have a question, but I just wanted to thank you so very much for what you've done for the Commonwealth and for the wealth of knowledge that you continue to offer.
Well,
thank you very much. Thank you, Madam Chair.
Thank you. And I do want one comment that you talk about, I guess, programs that are beneficial. The best program in across the country that's very well run, and it operates the way it was designed, is the WIC program. It specifically tells you what that participant can get, and it's monitored, and it's a well run program. Those pregnant women and children after they're born, the formula, it's a well run program. The only fraud I've heard in that is some people would sell their the baby formula, but that's not, doesn't happen that often. But it is a well run program, and if SNAP could be run that efficiently as the WIC program, it would be a much better program.
Be careful, Senator Higdon. I feel like you might be interviewing for a job in CHFS or some very important role. Representative Proctor.
Thank you, Madam Chair. And Senator Higdon, I'd like to echo Senator Douglas's comments. Thank you for your service to the Commonwealth. It's appreciated. One of my questions for you is, as a grocer, can you help us understand the challenges of having grocery stores in rural areas? Because we often hear these food deserts. I'm a little bit familiar with the larger chains. I understand there's only about a 1% to 3% profit margin. It's a lot of it has to do with distribution and things like that for the larger grocers. But can you tell us a little bit about why it's difficult to compete in that area or stay in business, and why we have these food deserts? Because I'm with Senator Douglas, I'm not so sure we have food insecurity. When I look around, I see a lot of obesity. So it seems to be a lot of food. But if you could address that, please.
Well, I'm no longer a grocer, like I said, but independent grocers are like dinosaurs. There's every year there's a few less of us because of the competition, and that's part of it. Being in business, sometimes competition will, just not enough of the pie left for you to survive. So that happens, and like I said, when we talk about the distribution of SNAP benefits, I know for a fact those smaller inner city stores really suffer when they're pretty much their entire base of customers are a large portion of their customers are SNAP beneficiaries, and like I said, and they come out that first 10 days of the month, and there's many of them spend them all at one time, and there's just a steep drop off. And like I said, the grocery business, profit margins are thin, and there's some there's some good months and there's some very bad months, and but mainly why I've seen grocers go out of business, just oversaturation of the market, where there's just more grocery stores and they all can't. The pie is sliced too thin for them all to make it, and there's a thinning that way. So, and it's cyclical too. I know when I first we built a new store, and there was a lot of country stores. Well, they all went out of business. Over the years, they couldn't compete against the modern supermarket. And then you had the superstore started to open, and you start seeing the independent grocers go by the wayside, and so it's cyclical. I'm sure the superstores are having some issues now with all the Dollar Generals that plant themselves around them. So it's cyclical, but there's a lot of reasons why we see those food deserts, but SNAP could be a part of it.
Thank you, Senator Higdon. As we wrap up your testimony, Co-Chair Lockett.
Thank you. I just had a couple questions for you. First of all, I do as well tell you thank you for all the hard work that you put into our Commonwealth and to the General Assembly, all the many hours that you've worked. Thank you so much. I want to get your opinion on a couple of things that we have bounced back and forth in terms of a waiver. Hot prepared foods, you kind of mentioned those before. One of the things that we have talked about is just things like rotisserie chicken. Being able to purchase that. I think I know why you can't purchase hot foods now. But if we did go to the twice a month benefits, so that is number one. Kind of your thoughts on that. Number two is on the fresh fruits and vegetables. When they're purchased at a farmer's market, as you said, you get $2 for every dollar that you spend. What would be your thoughts if that was also brought into the grocery store setting for fresh fruits and vegetables, also retaining that 2 to 1?
That's a good question. I've never really thought of that. Of course, the USDA, the agriculture, that's a supplemental to help those people who are growing that local produce. So it's kind of a difference in, you'd have to have a different program that would do it in the grocery store, I think, because I think it is a good program where you support those local farmers to grow that local produce, and you allow that additional that additional volume, where that's a real incentive for people to go to the farmer's market. But that would also be an incentive to buy fresh fruits and vegetables if there was some sort of offset at the grocery store. That would be very beneficial.
On the hot prepared
on
foods.
The hot prepared food, I would as a former grocer and from the intent of the SNAP program, once you start going down that road where you allow hot prepared foods, then you kind of I think there's that fine line. Rotisserie chicken, you can sell it cold. They can take it home, put it in the microwave. Most everybody has a microwave. That's almost as essential as forks and knives anymore. So I would not encourage to do away with that portion of SNAP benefits where prepared foods are not eligible. That would be my opinion. That's a former grocer's opinion. Okay.
That sounds good. Thank you.
Senator Higdon, again, you are a giver so generously of your time and your talent. Thank you for being here today as we wrap this up. And your report, by the way, Senator Higdon's 2011 task force is online now, and it's available in today's meeting materials.
Yeah. Thank you. And I've been here a while, and I thank you for those comments. But, and one of the things you're learned too, that as you go along, we're challenged daily, mentally, physically, and emotionally, and you grow spiritually, because believe it or not, prayer is the only thing that gets you through this place. And so thank you all for allowing me to be here today. Thank you.
Thank you. We maybe should have applauded Deanne Wank as well, because once you see the report, you'll see that her name is on that too from 2011. It might have sounded a little different than Deanne Wank, but Deanne is the same. So if next on our list is food and nutrition professionals, We've got Anne. Anne, I should have confirmed that I say Crecelius. Crecelius is a registered dietitian, and you can come forward. Anne, you've got a presentation for us. You're ready to pull that up? Wonderful. If you'll please introduce yourself. Your microphone would be bright green when it's ready for you. You'll press that button right in the center, but it's bright green. If you'll push right in the center. There.
Can you all hear me? Yes. A little bit closer. How's that? Can you hear me now? Thank you. Well, yes, thank you so much. I am Anne Crecelius. I am a registered dietitian here in the state of Kentucky, and I am here on behalf of the Kentucky Academy of Nutrition and Dietetics. And I just want to thank you all so much for allowing me to come and represent CAND and tell you a little bit more about what a registered dietitian is, how we are working in Kentucky to make our population healthier, and how we can partner with Make America Healthy Again to continue these very important conversations about improving nutrition and access to nutrition information for our population. So what is a registered dietitian? I feel that, just doing a quick overview of what a dietitian is in case anyone doesn't really know our background. We have a rigorous curriculum that we follow in college. Many classes, the same as pre-med, pharmacy, or physical therapist. We also do an internship that is greater than or equal to 1,000 hours, which is a little bit different than other allied professions. So the internship is separate from our education training. It is after our training, and this is different from like an OT or a PT or a speech language therapist. We do have to have a minimum of a master's degree, and we have to pass a national registration exam. And that is how we get our credentials as a registered dietitian. And then we must maintain our credential through continuous education hours every year. So what is the impact and role of us as nutrition experts? So I'm not sure if you've heard of the term medical nutrition therapy. That is a term that we use to describe what we are doing. Medical nutrition therapy includes assessment, which looks at, what the history is of a patient, their data, lab data, their health history, what their culture is, and how we can help them nutritionally. We also are in community and public health areas. As you all spoke about WIC, there are registered dietitians in the WIC program. We are in food service and safety, so we are in schools and other hospital settings in the food service industries where we make sure that food and meals that are prepared for anyone meets the nutrition standards, food safety, and other procurement in the food service industry. Dietitians are also in industry research and consulting. So we are writing grants, we are doing many research, probably some of the research on drugs and medications and nutrition therapies. We are doing those types of things. When I was looking at presenting for you all today, I really wanted to dive into what is Kentucky's health burden. And as Senator Higdon spoke, we do have an uphill battle here in Kentucky with our health. We rank very high in obesity, cardiovascular disease, diabetes, hypertension, and COPD. We are second in cancer deaths, and we are first in new cancer diagnosis. We are 44th in health outcomes and 47th in state chronic disease index. So when you think of healthcare cost burden, all of this contributes to that. And if you want, where I found this information in many different places, Kentucky University of Kentucky has a lot of this information that they have published, the medical school has. So this was interesting to me to kind of see where we were in Kentucky and how, as dietitians and nutrition experts, how can we help decrease this burden for our state. I think the most important thing we can do is increase access to cares of the nutrition experts. And as you know, you all have spoken earlier, there just isn't that great of an access. So when we look at obesity, are we helping patients or the overall population talk about what is a healthy diet? We talked about obesity, and people that are obese are malnourished. They are not getting the appropriate nutrients. And so it's hard to kind of think of it that way, but it is kind of a new thought. When we think of somebody that is malnourished, we are really thinking about maybe the very thin person that has, a diagnosis of cancer or has maybe not have great access to food. But when you think of somebody that is obese, you don't really think of them as malnourished, but they do have the same complications in the healthcare industry as the very thin person does. So how can we get better nutrients for everyone? So we have the Medical Nutrition Therapy Act, which is being reintroduced on the federal level, that will help increase dietitian care to individuals. And medical nutrition therapy is a one-on-one counseling for these at-risk patients. So looking at patients with the diagnosis of diabetes, cardiovascular disease, chronic kidney disease, obesity, or a cancer diagnosis, help growing all of that so that these patients have access to care. We also have food as medicine, and this is a benefit in some private insurances, also Medicare Advantage and state Medicaid programs. These are medically tailored meals for high-risk individuals that have had surgery and they've gone home. So these are meals that the people can get in their homes that are medically tailored, and also medically tailored groceries that these people can also have access to. Next, we have telehealth, which has grown so much during COVID. So again, increasing access to the nutrition experts. How can we get people, the general population, counseling for nutrition-related challenges? And then we have the Treat and Reduce Obesity Act, which has been introduced this year. So it addresses the obesity epidemic and improve access to tools for prevention and treatment of obesity. This is for Medicare beneficiaries. This is allowed in Medicare Part D to cover FDA-approved obesity medication and access to healthcare providers for intensive behavior therapy. Next is the Older Americans Act. This is part of the Department of Health and Human Services, the Nutrition Services Program. This reduces hunger and food insecurity among older individuals, promotes socialization and community engagement, and enhance health and well-being by providing access to nutritious meals and health promotion services. So thinking Meals on Wheels, that we are probably more familiar with that term. On a local level, with the Kentucky Academy of Nutrition and Dietetics, we are looking at trying to pass the licensure compact. How this can help Kentuckians is, again, increasing access to nutrition experts. Kentucky borders 9 states. There are many rural areas. As I am a practicing dietitian, I had to have a state license in the state of Kentucky, and I did practice in Indiana, right across the river from Louisville. So I had to carry 2 licenses and incur the cost of both, and also the requirements to hold a license for both states. this cuts down on that. So if part of the compact, you only have to do one requirement, and then you can practice in all of the compact states. So we are trying to get this passed this year. Next is the Kentucky Medicaid program. We are hoping to expand coverage of these diagnosis codes so that dietitians can offer nutrition support for these patients that need it. So the struggle with dietitians, we are not able to code. There is no coding for us for reimbursement. So we fall under either an ancillary fee, and again, that decreases the access for our expertise. If we are not able to bill and be reimbursed, it decreases our referral rates. So those are some of the challenges that we are working with, and again, that it's exciting that to be part of this conversation, and we appreciate being in front of you all and letting us tell a little bit about what we do on a daily basis here in Kentucky.
And thank you so much. And
Yes.
I know that we had to delay your visit by a couple different meetings because the agenda just kept filling up. But it's perfectly
Yes,
timed.
thank you.
And the next portion of our agenda, we will go over some of our findings so that we can finalize our report and actually agree upon it today. But a number of factors that you brought up, I don't think are new to us because we've now heard them for the 7 meetings that we've hosted, but quite a deeper dive. The funding from Medicaid is one issue. Is there private funding for that same, if there was a code for my health plan, could I receive that nutrition even though I'm not officially obese or I'm not officially diabetic? Can I receive your sort of medical nutrition therapy?
I do not think that there are many commercial insurances that are covering that right now.
Okay, thank you.
I know there's so many different insurance plans, and so I think maybe some do and some don't, but majority do not cover that at this time.
And that is unfortunately what we heard. We had our health plans present to us in our last meeting, and unfortunately we heard some of that. But we also heard quite a commitment to relook at that. So I'll encourage Can to
Yes.
stay involved and know that we'll lock arms with you. There's quite a commitment around nutrition, not just food, but nutrition.
Yes, that's wonderful to
Representative
hear.
Moore, I lost track. Oh, there you are. I would expect you to be right here, so lost track of you.
Sorry to disappoint, Madam Chair, but thank you. Ms. Crecelius, thank you for being here with us today and testifying for us. You gave us a good, thorough rundown of kind of the local actions we can take here in Kentucky, and then kind of a briefer view on some of the proposed federal legislation. The second one you have on the list, food is medicine. We've talked about that at length, and I feel really kind of familiar with that from our sessions. These other ones as well you have there, do you see these as really only applicable, hard word, at the federal level, or do you think there's an opportunity for us to take action here in the Commonwealth on some of these other acts as well that we could do locally? Because I don't care what party you are, DC's a mess, but there might be opportunities to do things here in Kentucky instead.
I agree. I think that there's definitely opportunity to do that in Kentucky, and since it is a smaller scale, then we have more, control and more oversight, and maybe better planning or better access to making pathways that these at-risk individuals can get the care. And I think, the Treat and Reduce Obesity Act, you all spoke about that with Senator Higdon, and how, the obesity rate has grown since 2011. So I do think that, bringing this back to Kentucky and for our population, I think would be a fantastic idea.
Thank you for bringing those to my attention, and others may already have much more background on it, but that's helpful for me as we think about potential ways forward here in Kentucky, because we can't rely on DC to get it done. We need to look out for ourselves, I think.
Right.
Thank you. Representative Proctor?
Thank you, Madam Chair. Thank you for your efforts in doing this. One of my questions is for you. You said that there's not the codes, the diagnosis codes for dietitians. Do you feel like there is more of an emphasis to give medications, injections to address the obesity before there is an emphasis on eating well or getting that a lifestyle change of nutritional changes?
That's a really good question. I do feel that the GLP-1s definitely have a space for patients that have a lot of comorbidities, and with the obesity and diabetes that is so high here in Kentucky, I do feel that they certainly have a space for helping the obesity epidemic. I also think hand in hand, there should be a dietitian referral with the use of those medications, or any medication that promises a nutrition or health related, that is nutrition related outcome, because there are some very specific things that as an individual should be doing to tailor their eating patterns so that they can get the best benefit out of the medications and have a better quality of life with these medications. We see some of these medications that, although they are helping the obesity epidemic and are helping blood sugars, if you don't change the behavior, and that is working one-on-one with a dietitian, if the medication is stopped, the patterns go right back. And so working with a dietitian with the medical nutrition therapy and meeting with a nutrition expert to help make individual plans is what medical nutrition therapy is about.
Fantastic, Anne. Thank you.
So are you seeing that happen? Is there's the same push to bring in this other element of the dietitians being involved and doing the educational aspect and working with the patient, or is the primary pathway to treat the obesity by giving these medications?
So I am speaking just from what I see as a registered dietitian in Kentucky, not on behalf of CAND, but as on Ann Crecelius. I'm a registered dietitian. I have many of these discussions in the state of Kentucky. I do not feel that dietitians right now are being referred on the majority of these cases.
Thank you.
Yeah, absolutely. The good news is my daughter's now 15, but 15 years ago when I was 41 years old, I had the best registered dietitian. Thank goodness, because I thought I was on track until I got my personal plan and got corrected because I was not on track. Senator Tishner.
Thank you. I'm interested in what your work is or could be in our public schools. We've had a lot of intention in the legislature to focus on mental health. Could there be an opportunity where we're addressing some of the needs in public school, specifically mental health, to look at a student's nutritional intake, and if that could be a contributing factor to some of the chronic things that we're seeing with students in K-12?
I definitely think that would be helpful if there are dietitians that are going into the school system and talking to children and educating them about good nutrition. As we all know, it's not a diet, it's a lifestyle. And my kids will tell you that until they're blue in the face because they've heard me say it a million times in their lifetime. So it is a lifestyle. And how can we arm our youth with good decision-making skills? And it's not about food is good, food is bad. It's a lifestyle. And how can we incorporate many different choices and still have a healthy outcome? I feel that with the obesity, kids do get bullied, and mental health definitely is associated with that, with the obesity problem, or with girls or boys that are suffering from anorexia or other type of eating disorders. That all takes a toll on your mental health. And if we can have the nutrition experts in these schools arming these kids with good decision-making skills for what food they're putting into their body and how to fuel their body, I think that we will see better outcomes with less comorbidities when they are older, and maybe even better mental health.
You're giving me chills, Ann. On that, Representative Callaway?
Thank you. Thank you. This has been really helpful.
Thank you.
I'm kind of going to piggyback on what Senator Titchener was asking about. That was kind of where my mind went as well. Public education. I'm interested in, actually, let's start with the Academy, the Kentucky Academy. About how many members, first of all?
We have close to 900 members throughout the state of Kentucky.
So practically speaking, putting a dietitian in every public school could not be a practical resolution. However, I'm thinking maybe even a member of a board. But have you seen any kind of communication, a pathway with KDE or CHFS that's opening up a window for this opportunity for dietitians or for experts to get in and have conversations with the kids or do the exams that we're talking about? I mean, has there been any kind of outreach? We know, again, the mental push has been there, the aspect. Have we seen any kind of communication between your academy and our cabinet?
I am not sure. I feel like maybe a colleague could answer that question better. I can research that and get back with you if that's okay. I do think, although I say we have close to 900 members, we do have other dietitians out in the state that are not part of the Kentucky Academy because it is it's a membership, and so it does cost to be a member of this group. And so there may be some people, other dietitians that their work is not paying for it. So therefore they are not part of the Kentucky Dietetic Association. So there may be other dietitians out there. So I guess my 900 is just based on how many members we have in the Kentucky Academy of Nutrition and Dietetics. So for your question about have we reached out to the school system, I'm not 100% sure on that, but I am happy to ask that piece to someone that may know better than I do.
And maybe the option, if you don't mind, and maybe the option is maybe reaching out to the existing staff, so the nursing staff that is required, and maybe extending the education for those individuals, something along those lines, which I forgot I was going to ask too. What extended or continuous education do you all have to continue
to continue? We have to have continuing education hours, just as physicians, nurses, and it's to keep my registration, it is 60 hours every 5 years. And I think your suggestion of reaching out to the nursing staff at these schools is a really good idea. I think that would be a really good pathway for a first introduction, since school nurses are there on a regular basis, and partnering with school nurses. They do have a medical background. They understand the importance of good nutrition. And, if you're sick or if you're upset, even, mentally, sometimes you go to the nurses. And so I think the school nurses pick up on a lot of information that other people in the school don't necessarily pick up on. So I think partnering with the nurses, since they have a medical background, could be a great path into those schools.
Great. I'd love to support any kind of movement towards
Thank
that
you.
and the communication between the cabinet and whatever we can do to get footing inside of our public schools. Thank you.
Thank you. That's a great idea.
Senator Richardson?
Thank you. Thank you so much for being here and sharing your profession. This is very personal to me, as I've got 3 of the smartest women in my family are all RDs. I've been texting my sister-in-law today during this. I apologize, as she's the director of diabetes medicine at a hospital in Nashville, the first RD to be director, as they noticed that she had a subject matter expertise with their training. So I appreciate what you explained. I think you're being a little humble in your profession, that you truly are. RDs are truly the nutrition experts by training, qualification, testing, licensing, and the liability you carry as well. I think it's unfortunate that we're at the last meeting and you're here. I wish you could have been at every one to testify on everything that we've talked about during this interim. I do want to note that on registered dietitians in the school, I know that my local school board and many in my others in my district use the RDs that are employed with the local health departments. So that's the contact in which they're using. I don't think that is a Kentucky Department of Education norm across the board, but that is a way in which they are utilizing registered dietitians in the school. And I do appreciate your comment about obesity and food deserts, and sort of the misconception there that skin and bones does not necessarily mean the only lack of nutrition or food that's out there. Obesity certainly hits that criteria, and we should be looking at it differently. I just want to say thank you again for you taking the time, and I hope that we can continue the conversation with you, your colleagues, in this profession, and how nutrition affects, and not recreating the wheel, but leaning on the perfect wheel that's already been created.
Thank you so much for that. Thank you.
Good. Representative Duvall.
Thank you, Madam Chair. Thank you for being here today. We appreciate it. What a great message. So ultimately, our childhood obesity issue, comes back to parents, because parents are ultimately responsible for their kids. So how do we incentivize parents to be involved in this process?
That's a good question. I'm trying to think. Again, I think it's just educating them. And children do pick up on the habits of their parents, whether it's consciously or subconsciously. So how can we get to the root of the problem? We can be in the schools and try to teach the kids and, show them that there are different and possibly better choices apart from what they're seeing at home, but also reinforcing those decisions at home. So whether it's bringing parents in and helping them be a part of it, whether it's, maybe bring the parents in and cooking a healthy meal for the kids, hands-on learning always is beneficial, but just trying to have the parents involved in the education as well.
Well, I agree 100%. I think we have to get the parents involved, because at the end of the day, we can educate and we can do everything in the schools that we can imagine. But when they go home and they're not seeing it, they're not living it out with their parents, then we're not going to get the results that we want. So I think we need to really take a deep dive into how do we involve parents going forward.
It's such a behavior change. We grow up with food as celebration, food as comfort, food as, a punishment, food as a reward. And all of those little examples that we see throughout our lifetime set us up for what we're doing and our choices that we're doing. So if we can involve, everyone, whether it's the teacher that says, here's candy for getting 100 on your test, or, you can't go outside and play because you did something bad. So it's, it's hand in hand. How can we make everyone aware of these little choices that they're making every day and how it impacts the health or the thought process of these kids?
Anne, you are a perfect exclamation to our visit today. So we give out beef jerky snacks is what I'm gonna promote. Thank you again
so
for being
much.
here.
Thank you.
So as Anne is wrapping up, we're gonna place our presentation of your input as committee members, and I just wanted to take a moment while we're getting that presentation pulled up to thank each of you for taking this so serious. And we've had 7 in-person meetings and then an 8th at the University of Kentucky So I don't think we ever want to minimize the importance of our extension offices that are in all 120 counties. The perfect wheel that you described, Craig, you're right, or Senator Richardson, does exist. But it doesn't seem that we always jump on a wheeled vehicle. We seem to be going back to something that is just too ultra processed and in the wrong direction. Just the for discussion part? Okay. We're going to pull up a couple samples of legislation and want to take a minute with the task force to get your input. I do have two guests here that I'm not sure if you did want to speak. Diana, did you want to speak? Okay, you may go ahead and come forward and introduce yourself. And then Barbara, did you want to join Diana as well? Okay. And please introduce yourselves for the record. And if you've not testified before, the microphone gets a bright green colored light when you're ready to introduce yourself. Thank you. And I know that you'll be quick, but I just wanted to let you know just a few minutes. Thank you.
There we go. Now can you hear me? My name is Diana Starr. I'm CEO and founder of United Doctors of America Incorporated initiative. Go closer to this. Okay. Now you can tell that I'm naive at this, so I'm not used to talking in front of a committee, but I'm very passionate about what I did and what I do, and I have spoken with Senator Shelley before, and I appreciate that conversation. I am here not only as the founder of United Doctors of America Reform for Healthcare and Patient Trust, but I'm here also to report for MAHA Institute for Washington, D.C. I've been in direct communication with them regarding your task force. We're honored, and they were very excited to see that there was a task force going on. MAHA's role, and I'm going to address Representative Moore, MAHA's role is definitively what you said, and I'm a little nervous, as you guys can tell. It is to support the state legislation toward making America healthy again. It is not to be a institute as a physical institute, but it is very involved to see what the states are doing and to make sure that they go forward with all the things that they need to do. For so long, we put food as peripheral. It was not the importance of health. We didn't say, we start with soil. We didn't say any of that. We thought of all the other directions, and I appreciate Amy and Barbara both for supporting the MAHA agenda. We need to address everything that you've talked about, and through Shelley, I did find out that you have a KDD program. How do we strategize to get that out to the public? After I spoke with her, I started querying different people in the state. Did you know this? Were you aware of it? And they weren't. So I think we need to have a better education system for getting that word out there, because there are people in rural areas that just can't get up and drive to the local farmer's market. That's one thing that I made a notation of. MAHA is ready and willing to work with Kentucky in any way it can. When I leave here, I'm going to, like I said, report back to them everything that I've wrote. And United Doctors of America, you're going to ask me, how's that work with MAHA? Because we believe everything they believe. We don't like the fact that certain things that are healthy for our country and our state are denied through insurances. That's one thing that we need to do. Physicians need to be on board with a nutritionist. And as everybody probably already knows here, and I might be redundant in saying that physicians a lot of times are not educated at school. They're not required. I think it's 30 hours or something in nutrition. And we have to begin with the food in order to eradicate the chronic illness of the children. So United Doctors of America isn't just doctors. It's every healthcare provider. It's every man, woman, and child, every parent, every grandmother that says, hey, I want health care reform. I want to be able to trust my physician. I want to go to them and they say, let's just not put a pill. It doesn't begin with a pill. It begins with everything. You have to look at it as a whole healness and whole wellness. And when I was trying to prepare quickly something to say to you, there was so much, because I have so much passion that comes up with me about this, and I travel back and forth to DC a lot. I did send an invitation out to Shelley to share. Maha wanted me to make sure that the Institute is having a Reclaiming Science Roundtable in DC on January the 30th. Just reach out to me. I can make sure that you're on the list. It is a private invitation, but they were so excited that there are not task forced anywhere else that I know of. And they said, why cannot Kentucky be the lead? Why can we not be the flagship for a new initiative to say, we are working with Maha. We're not just talking about the words, make America healthy again. You guys today discussing everything, it falls on the state. Maha Institute is there to support the state legislator. They're not going to come in here physically and take over. But I think it's important for national footprint to see that, hey, we care. We're not just a rural country or a county, or we're not just a rural state. We're here involved doing. And when I found out about it, I'm sorry to say that I found out too late that this is the last one. And so that's what I really got to say. That's how the two are working together. We're working in DC as United Doctors of America. We're working as Doctors for America First. We're 501c3, 501c4. And we're working hand in hand with Maha every day more. I really encourage you, if you can go to that round table, that you're going to learn a lot of information that legislatively that you can use in Kentucky, and how they'll support you with funding and national exposure and say, look what Kentucky's doing. The only thing I did see that we have not done yet, and ask me or correct me if I'm wrong, we have not yet passed the SNAP benefit thing about what they can buy with it. Am I correct or am I wrong?
That's correct.
That's correct. I looked at the states. I know Barbara's from Indiana, formerly from Kentucky, but they have passed in Indiana. So I think there's only 6 states. I would encourage that. Education, how are we going to educate? It's a question. How are we going to educate parents that really don't care? Because the children are what our future is about. So somebody, I think it was it you, Representative All, that says some things need to be put in place so that they say, hey, we do need to educate ourselves so we have our children for the future and we have healthier children. We don't have chronic illnesses, because it works together. If I had eaten right when I was young and I had known any of this, today I would not have diabetes. Today I would not have other circulation issues. I would not have issues that I have if my parents, but they were poor ministers, and you ate what you could. We all know that here. There's some that are my age. So now, looking forward to the future, I am emphatically on board for whatever needs to be done. And I told the Maha Institute that they want a list of all your names that can work with them. I'm going to supply that with them when I give my report. And I think, unless you have any questions for me, I've said it about it.
Thank you, Diana. And we feel very passionate. Fortunately, we have been in communication with HHS as well and previewed some of our considered legislation, including removing fluoride from the water. Representative Hart and I had a meeting with them about 8 weeks ago. So we're grateful to receive statewide recognition of what's happening in other states. That'll be our next part of today's meeting. We're going to review a couple other states' ideas as well. But thank you for your kindness and for sharing our good work. We know that we're hopeful in all of our meetings that we've signaled very clearly throughout the state of Kentucky that we're committed to a wellness revolution.
Yeah,
I think we've worked hard to signal that. Barbara, did you have anything you wanted to share before we move on?
Sure. Can you hear me?
Yes.
Oh, great. Okay. Well, first of all, I live in Indiana now, but I'm from Louisville, Kentucky. We moved there to be close to our grandkids. I don't know if
We'll welcome you back, Barbara.
But, I have a long history with wellness and health promotion in the state of Kentucky. And in fact, you probably don't know this, but in 2007, when Dr. Fletcher, who was the governor, he started a statewide wellness program. I don't know if you knew that, but it was very effective. And I had a health magazine, and we were promoting it. We were going all across the state, working with nutritionists, fitness people, talking about health, talking about nutrition, talking about fitness. And then when he didn't get back into office, when the first Bashir came in, he cut it. Because he said Obamacare was going to come in, and that was going to take care of everybody's health. So we know how that worked. But with that said, also, I'm from Louisville, and in Louisville, and I can't really, not sure exactly the timing, but they had in the Jefferson County Public Schools, they had what they called, I think it was a coordinator for health promotion. And at that time, and you probably don't remember this because you were probably a baby. No, I'm just kidding. But anyway, at that time, dietitians and fitness people would go into the schools for health promotion. And my school was Fern Creek that I went to, and Ballard High School. And I would go and talk about nutrition, different aspects about it. And, when you go into the schools, you have to talk their talk. I mean, you can't say, no this, no that, and this is what concerns me now about what's going on. I'm familiar with the people at USDA. I know Brooke Rawlings. She's excellent. We've had a discussion about the school lunch program because I also worked in the school lunch program at one point. And, when they come and they start making some recommendations like what Michelle Obama did, a lot of kids stopped eating the school lunch program. So when the changes come, and there are going to be changes, which are going to be MAHA changes, then we're going to have to deal with that, at the school level as well. But I'm so encouraged that Kentucky is now out there again and is going to be working on health statewide. But I can assure you that people, I hate to tell you, I'm 75, and the whole time I was in Kentucky, many of us were working in the same light and trying to get, people to be more fit, people to eat better, and hopefully you guys, because it's at the state level, you guys are going to be successful. I really do hope that you are. And I think now's the time. And I do think you guys are passionate. So good luck.
Thank you so much. Thank you. So as we move on to the next phase of our meeting, I did want to appreciate Barbara and Diana for being here. The best time to grow a tree is 20 years ago. But we have today. So we're now at a point that, yes, 20 years ago, Ernie Fletcher made great efforts. There have been great efforts before us, but now's our time to do our very, very best. And we're going to take a few minutes and look at some ideas from other states and then review kind of our final recommendations. And I'd like any further input, and we'll take those into consideration. But we'd like to be able to provide our recommendations. There's no doubt that root cause wellness became front and center. I do recognize that the experts that we experience with Dr. Huber's integrative health, Dr. Larkin's integrative dentistry, the advanced practice registered nurse Kim McKenna shared such great information, but then what we saw from Egg Commissioner Shell and what Appalachian Regional Health System piloted, just food as medicine really took a clear perspective to us in the way, and the joint employee between the Kentucky Department of Health and Agriculture as well. What a great way to collaborate. So I think we've shared some real innovative ideas. but how do we put that into legislation that we aren't continuing to promote a lack of wellness? Senator Higdon shared some ideas. So what's next on our slide on the recommendation?
Logan's going to
Yeah. Okay.
go to slide
Logan,
4.
you're going to be our driver. Okay. Thank you, Logan.
Go to slide 4.
Slide. Okay. So this, actually go back to 1. So what you'll see, this is, I believe you will have seen this before today. This healthy foods. Yeah. This healthy foods was a bit of a summary from our previous presentations, the previous 6 presentations, bringing support the food as medicine. These are part of our recommendations, but I'm putting it out there in case any of our committee members disagree or agree more wholeheartedly. Number 2, address the purchase of healthy foods with supplemental nutrition. Of course, that was reinforced today by one of our longtime grocers. Seek ways to improve healthy meals in schools. Of course, Diana reemphasized that as well. We heard that from our nutritionist. I really did love the ideas shared today of coordinating that more closely with, now that we have nurses in all the schools, most of the schools, find ways to address public education and access to foods that are ultra processed. I think that's part of your point, Rep. Duvall, that we need to educate our kids, but if the parents aren't walking it and talking and living it. And what's the next slide, Logan? Yeah, so from the physical health and wellness, these were shared that strengthen the physical education requirements for high school graduation. I do believe I've seen a few draft bills, but how you go about implementing these ideas, I think I've also seen a number of conversations with Robbie Fletcher, with our Commissioner of Education. So I'm really liking a lot of the collaboration that we're seeing around all of these policies. I think that'll be so important. As we know, our task force is one that maybe we can lean on each other to help lobby our own caucuses in our respective spaces to see some of this meaningful legislation moving forward. Yes.
I would say too, if you have a bill really that revolves around any of these things that we've talked about, whether it be physical health and wellness or something from the slide prior or something that we're going to talk about, if you've got a bill that you're passionate about and you say, I'm going to file this, I'm going to run with this, you don't have to check with your fellow members, but I think it would be very helpful because there could be somebody else that wants to do the same thing. And so it could be very helpful instead of having 2 or 3 bills with the exact same topic that we coordinate and say, hey, this is a bill coming out of the task force. There are multiple people that can sign on as co-sponsors. I always like to say this, if we are, and I'm not the author of this, so I'm not going to take credit, but if we are not concerned with who's getting credit for a bill, we can accomplish great things. And I would encourage all of us when we talk about these issues and turning these into policy and bill requests and then bills to not be as concerned with whose name might be at the very top, but to say this is a good policy for Kentucky and we can all work together to achieve these goals.
And I've got a hunch that our floor leaders are going to second what Rep. just said. The number of bills that we might see are going to continue to be limited. I see a bill master in this room, and I'm not looking at him at the moment, but he's going to hold us back from too many bills coming across. So I second your thoughts on that, Rep. Lockett. The next slide on functional medicine. I'm certain you're not surprised that this is going to come as one of our outcomes, that we're really going to look at lifestyle medicine or some direction of integrating nutrition and diet strategies into our expectation of the way our medical doctors, nurses, all folks that are going to come into the conversation with any Kentuckian better informed on lifestyle and the impact of nutrition. And that was so well said today. Malnourishment could be directly correlated with obesity. Obesity does not mean that you're nourished well. So improve that health insurance of health programs as well. I've not heard from enough of our members of who's really working close with health insurance companies. Would love to see a real push there, and encourage the integration of functional medicine principles and preventative health initiatives. And then, is that our last one, Logan? Oh, okay. So a few examples, and each member does have these examples in your packet, but both Texas and California had some very meaningful bills around some conversations that we've had presented during our interim. So I just wanted to suggest to our members, consider really reviewing some of what has now been put into legislation in other states. And maybe you even know other legislators that are in those states. What sort of responses are they getting? So as you're preparing to file your legislation, how's it working out for those states? Maybe check in on that a bit. But this key provision of SB 25, the Make Texas Healthy Again, talked about mandatory food labels, warning labels rather. Also, SB 25 talks about nutrition education required for K through 12, higher education and medical schools. So that is already kind of crafted in SB 25 for anyone who's working on that, myself included. Physical activities in schools, K-5 mandatory nutrition advisory committee established, enforcement by Texas Attorney General, and civil penalties. Kind of interesting. What's the next slide? Any questions on that? And everyone has that to look at. I felt like our policy specialist, Matt Hall, on our team did such a great job doing research. Deanne and team have done some great research and bringing some ideas to us. Other related Texas legislation, that SB 314 on the school meal restrictions, it does prohibit schools from putting certain additives and artificial ingredients. I know we saw a bill earlier in our task force from Rep. Doan on some of those additives. But again, if anyone's working on this, I'll also ask you to maybe connect with Rep. Doan. He was working on this. I don't officially know whether he's filed. We'll prepare to file anything. SB 379, the SNAP benefit. I know Rep. Lockett filed an excellent bill last session and may have made a few modifications to that, but this SNAP benefit restriction is definitely on our radar. So if anyone's working on that, any comment or anybody want to share legislation that you are working on or any input to this? Holding it close to the vest. And then next slide. So California Bill 1264 is known as the Real Food Healthy Kids Act, requires gradual elimination of certain ultra-processed foods and specific food dyes. So again, something fairly similar, but a little more gradual. Governor Gavin Newsom signed that into law on October 8th. We know, Anne referred to this as well, I think Diana referred to this as well, that there has been an update in USDA guidelines and FDA guidelines. It may not roll out quick enough, candidly. So we could take action in Kentucky that may more quickly affect our Kentucky kids and our Kentucky families. So we don't want to lose sight of certainly what's happening at a federal level, but what we can execute on the state level. And that's the last slide. As we wrap up, is there any points that anyone wanted to make The first 4 slides were kind of a summary. So much like Senator Higdon established in 2011, we aren't trying to make all the changes as a task force. We're just trying to promote what we believe were meaningful outcomes. But I think our real actions take place come January when we file legislation. And candidly, I think much of the work that we've done has signaled. I've seen Profetti Van Mel in Northern Kentucky. They've already started to remove some dyes from their gum and from much of their candy. And I've had some regular conversations since we've rolled this out with a number of people throughout the state. So I think that people recognize that all of us are committed to wellness and improving our health. It's tempting, though. I don't know about you, but when I see some chocolate candy greeting me on my desk, I can't resist eating that either. I'm a bit on the seafood diet. And I like dark chocolate covered almonds. Emily, Representative Callaway.
Thank you. So going back to healthy food slide, number one, we've been talking about food as medicine. And what I've heard come up multiple times is opportunities for our local health departments to participate. And I just don't see a consistency there. So I'm personally going to be reaching out to that cabinet and just seeing what the disconnect is. Louisville should have a very strong health department. And with that health department, it should include, obviously, this mentality of food as medicine. And so I would just like some accountability that that's happening. I see local food market or farmers markets, specifically in Louisville. Again, it's really disappointing that I don't see some of them, what I've been told, honoring some of the SNAP, the 2-to-1 options and all. So there is a disconnect with our local communities. I'm going to speak for Louisville specifically because I'm recognizing that. I do know I also represent part of Bullitt County, and I have seen the health department there step up, and they've got a mobile unit that they're reaching out. But with these extensions, health departments should be cooperating very closely with all of the efforts. And I don't see, based on the testimony, where health department opportunities have continuously come up. I just don't see that's happening. So I don't know what that looks like legislatively, but I intend to reach out and make a connection and just kind of dive in, especially with the new commissioner. So I would like to just say that, and if anybody else would like to get in on that, if you see something locally with your health department and we can address it, that's kind of my take on that. And then again, locally speaking, coming alongside agencies that are doing things. It is a budget session, so I'm going to do a shameless plug for one of the budget items that I've requested for our Dare to Care, our local Dare to Care. They have seen an emphasis on the desire for the fresh food, and so they are purchasing some land and will be creating a facility for fresh food items specifically. So there is a push to provide the fresh food. They also have programs where they bring families in and teach them to cook. They're cooking classes. Again, something the extensions that our money, the settlement money should be going toward, and we can supplement what they're doing. So I see some opportunities to come alongside our local entities. And again, Dare to Care, 8 counties or more, and they supply within our Commonwealth. So I think it's an organization that is listening to the heartbeat of where our Commonwealth is heading. And so again, it's kind of a shameless plug there. But I think if there is some local entities that are working with our farmers, working with our schools, working with our hospitals that we can connect with and encourage those connections, or temporarily fund, one-time fund, I think we should act on that. So that's kind of my takeaway on those two things and what I'm looking into. And I thank you for this. I think it's been very helpful. It's been very educational, like you said.
I think it has spurred some movement within our Commonwealth and even throughout the rest of the nation. Again, whatever we can do to be a voice and carry out the intentions of our the federal government, the move they're making as well, I'm encouraged by it. So thank you, both chairpersons, and for all of the people who have come and helped us to wade through all these waters. Thank you.
Yeah, thank you, Representative Callaway. I will acknowledge another great news that was shared in Louisville is a faith-based initiative. One of the largest churches in Louisville has created community gardens. So when we talk about the responsible use of the taxpayer dollar, it's not necessarily a taxpayer solution. There are faith-based solutions throughout the state that are taking really, really small actions that can grow into something quite meaningful. Earlier in September or August, we heard even from the mayor of Louisville about taking community space that is part of their parks and recreation into growing food. And then another idea that I don't know how we take it to another level around the education and around tools, a wheel that's already been created is you can go to your extension office, and I shared that I learned to can earlier as a Mother's Day gift from my daughter to me at the extension office. But why don't we go to the extension office to pick up our SNAP benefits? Maybe we need to continue to puzzle through how to use, as you mentioned, Representative Callaway, the public health, the resources that are already out there. How do we press for better collaboration? And again, I use the example of the Kentucky Hospital Association and the Kentucky Department of Agriculture collaborating, sharing an employee. These are precious taxpayer dollars that are already spent. We have infrastructure already in place. What can we do to press for a better use, a more efficient use of the taxpayer dollar? I think we've put great efforts towards that in our work thus far, but we do not have the ability to go to zero income tax if we plan to spend more money on things that we file. So we've got to be so careful to use the taxpayer dollar much more wisely than we currently are, with an expectation of much better results. Let it be put into the history books where Kentucky is today, and I'd like to see where we are in 10 years, because I am absolutely believing that all 10 of us on this, plus our 2 bonus members, are absolutely committed to see these numbers much improved. I'm going to say 100% improved than where we are today. My co-chair Lockett.
Thank you. I just want to say first, thank you to all of our members, all of your input, all of your email, well, most of your emails, almost all of your emails. And I appreciate all of the participation that we've seen in our meetings from our communities and our businesses. These are things that affect everyone, not just us. They affect business. They affect Kentuckians. And obviously our goal is to make Kentuckians healthier. We've seen over and over and over and over again the stats, and the stats aren't good for where we sit as a Commonwealth. And so it's important to us, it ought to be important to everyone to improve those stats in whatever way that it takes to allow our people, our Commonwealth, to be healthier, to get our disease rates down. I also want to say thank you to our awesome LRC staff who has worked so diligently, so hard, the entire time, month after month, all of the reports, talking to us on the phone, texting, emailing. What are we doing this month? Who should I reach out to? Guys, thank you very much for what you've done. You're rock stars, and we certainly couldn't do it without you. One more comment that I've got as well. We have seen throughout our meetings, throughout pretty much probably every meeting that we've had, I think, the correlation between Medicaid and SNAP benefits. There's a lot, and so we are working with. I've had multiple meetings with our task force, the Medicaid Oversight Advisory Board, Chair Fleming, working with ways of how those two correlate in terms of possible legislation, in terms of things that are coming out of their board, recommendations coming out of there. We know that we have to get a handle on our Medicaid spending. There's no, well, we can wait till next time, or we can wait till 5 years from now. We have to get a handle on it, and we have to get a handle on it now. And so we have to come up with solutions of how to do that. And so as we work together to do that, keep in mind it's not just about the bottom dollar, it's also about making Kentuckians healthier. And so when we make Kentuckians healthier, our costs go down. And that's the bottom line. And so when we look at recommendations, whether it be SNAP, whether it be something else, that's our goal. That's what we want to achieve. And we can do it. And I don't use this as a rah-rah speech, but it kind of is. We can do this because we have to. And we're at a point where we don't really have a choice, but we should want to do this. As elected officials, we should want to make our constituents healthier. And so that's our goal. And as we move forward with legislation, whether or not it's something you like, whether or not it's something that everybody says, yes, that's what we should do, that's the purpose of legislation, is to hash that out, to have those discussions. So I encourage all of our members, if you have input, and I know you may not want to share it here, and that's okay. If you have input in regards to SNAP benefits, in regards to anything that correlates with SNAP, please get with me. I'm going to be working with our Medicaid board to see how those correlate in terms of legislation. So I just want to put that out there. Thank you, Madam Co-Chair.
Absolutely. And on that, is there a motion to approve the final recommendations?
I make a motion to approve the final recommendations from the MAHA Task Force.
Is there a second? A second with Representative Proctor. Secretary, please call the roll.
Senator Chambers Armstrong, Senator Douglas,
Aye.
Senator Richardson, Senator Wheeler, Representative Callaway,
Aye.
Representative Duvall,
Aye.
Representative Moore,
Aye.
Representative Proctor,
Aye.
Co-Chair Lockett,
Aye.
Co-Chair Funky Fromeyer.
Aye. With 8 yeses and 0 no votes, the final recommendations are approved.